Hello, everybody. So, through the last few weeks, ever since our course has come out, we've been receiving loads of messages and calls, and we have been clearing a lot of your queries. So, as we've been talking to students, I've come to realize that a lot of you are interested in certain branches of pediatrics, especially the systemic branches these days. So, these branches are sort of niche, especially with respect to the dearth in the number of seats, be it pediatric gastroenterology, genetics, pediatric rheumatology, etc. So there's so much little of this that is known, whether it be how to prepare for these exams, especially through the INISS, where you're targeting essentially one seat or two seats through the year, or even it be how the prospects of the branch are going forward, and also through the DM training itself. So trust me, these are exceptional branches and courses as well. But each of them have their pros and cons, as everything does have. So we've done this small venture for you. We've made a small playlist of these interviews, even podcasts, if you might say so, with these exceptional individual toppers who have recently topped the INISS exam in these various specialist fields, super specialist systemic fields. And we've talked to them not only how their training, they expect their training to be, what interested them towards this branch, and obviously the possible prospects they look forward to. So without further ado, let's get into the talk. Hello everybody. So today we have Dr. Swaminathan with us, one of my favorite juniors at pediatrics in PGI, and a really good friend who has now aced the super specialty exam, the INISS exam for pediatric cardiology, where he has got rank 1, and he's now ready to enter the wonderful field of pediatric cardiology. So Swaminathan, first of all, again, congratulations.
Thank
And
you so much.
yeah, like before we get into talking about the branch and your preparation, just a brief introduction about yourself to our listeners.
I'm Swaminathan. I'm from Pondicherry. I did my UG from Government Medical College, Pondicherry, and then I did my MD Pediatrics from PJ Chandigarh. Of course, I was your junior. And then I was doing a brief senior residency in my UG college, like Government Medical College, Pondicherry, for 6 months. And then, I took a break for 2 months, and I got seat in this time.
So, like I just mentioned, I personally have very, a very strong positive opinion about the branch of peds cardio. But personally, I haven't been practically involved much, as you know, the branch as such is a new one as far as PGI is concerned. So we at MD are not really well versed with the practical aspects of it. But can you introduce to us the field of pediatric cardiology, and also what made you like it for you to choose this branch?
Actually, sir, since my UG days, like the second year, third year, I always had this fascination for cardiology, especially while seeing cardio patients in wards, for taking like clinical rounds everywhere. Then I was fixed, like when I finished my MBBS, like I am going to become a cardiologist by any cost. Then I got MD Pediatrics. Then also I was in a thought process like, okay, I'll finish MD Pediatrics, then I will go to and do adult cardiology. Whoever likes cardiology, that will be the pathway. Either they will take MD
Yeah,
medicine or
usually.
MD pediatrics. Yeah.
Yeah.
But there was only one gateway at the end. Like if they want to become cardiologists, they have to do adult cardiology, even
Yeah.
pediatricians. But as the medical field is just improving, if you see when I was joined MD pediatric, that time I used to take these small kids for echo as a junior, to the cardiologist. We will be accompanying the kids there. So
Yeah.
that time I just developed this interest towards the congenital heart disease specifically, and then that time, like if you see both pediatric cardiology and adult cardiology, mostly they will be dealing with this myocardial infarction, and then coronary bypass or the stenting. These things
Yeah.
they will be dealing mostly. But till some 5 years or 6 years before the time, they were only dealing with this congenital heart disease. But
Yeah.
as the number of diseases is also increasing and the technology is also increasing, now more and more intervention based device closures for this congenital heart disease is keep on developing. and more advanced surgical techniques are developed by the CTVS surgeons. So they need to optimize the kid before the surgery happens and also take care of the kid after the surgery happens. And most of the surgery can be done even during the neonatal period. So for this, they need a pediatrician who can handle the cardiology patients. So that's why this branch developed, and now it's developing. If you look into the number of seats, only among central institutes, I think AIMS Delhi, PJ Chandigarh, and now recently Sri Chitrathirnar. Only these three institutes have this course. And if you see outside these institutes, I think in NEET SS, Jayadeva, like Heart Institute in Bangalore, they have DM program. Remaining all heart hospitals like Triple M, Nara and Hyderabad, they have this DRNB, pediatric cardiology courses. And mostly, personally feel like in the next 5 to 10 years, there will be more number of hospitals and colleges who will be opening these seats, and there will be a huge demand for pediatric cardiologists in all cities, like peripheral cities.
Yeah, definitely. Because like branches like cardio, neuro, they're even already they're super specializing into,
Mm.
people are doing fellowships. They're not, nobody's
Mm.
limiting themselves to, DM adult cardio also.
Ah,
So like why not choose such a, prominent super specialty like peds cardio and do it from the beginning itself. So that is like, amazing opportunity for anyone
mm.
going
Because
through.
previously, before this, if they want to do pediatric cardiology, they have to do adult cardiology and do a fellowship separately for two to
Yeah,
three years
yes.
to become a
Yeah,
pediatric cardiologist. Now,
yeah.
we pediatricians have this option of
Of
pediatric
opportunity.
cardiology directly by entering
Yeah,
this branch. So, I feel
exactly.
it's a good thing to
Yeah,
learn it
yeah.
in an early phase itself.
Yeah, from a third person perspective, suppose there's a, MD resident in pediatrics having this doubt of whether or not to take pediatric cardiology, and obviously he will weigh his, interests, pros and cons. So from that perspective, like what do you think, what are the pros and cons of the branch as such?
Uh, Before talking about the pros, I feel like I should be talking about the disadvantages. That
Okay.
will be better. First, this branch has a long learning curve.
Yeah.
Like once you finish the DM pediatric cardiology, it's not like you have become the best pediatric cardiologist. See, most of the thing which we'll be doing in pediatric cardiology is intervention, which are like you it's having a like long learning curve. Like you cannot master these interventions just by doing DM for 3 years. But of course, you have to work again for next 5 6 years, and then you have to master the skills. That thing is there. And second thing, you cannot be a solo warrior in pediatric cardiology. It's always about
You need
team
a team.
effort in pediatric cardiology.
Yeah.
Like you need a good CTVS friends who can operate your cases, and then you can follow up those patients. You need a good cardiac anesthesia backup, and then you need a good pediatric intensivist also then to manage these patients. And then you need a good ICU support, ICU staffs, everything. It's not like you are a pediatric college, you can manage the on your own. So
Yeah.
you cannot be a solo warrior in this branch. Always, it's like a team effort. And third disadvantage in this branch, which I not disadvantage, it's like some might consider disadvantage, some might not. Now at present, like whatever I told, like the steam effort. So you need a good CTVS surgeon, cardiac anesthetist, and then ECMO, and all the like cardiac, like pediatric intensive. These setups are now available only in tier one cities like Mumbai, Chennai, or Hyderabad. So like I down in the lane, like in next 5 6 years, even in second tier cities, like these heart hospitals will be developing. But at present, you will be like mostly working in some metropolitan cities where this setup is there.
Yeah.
Like once this setup start expanding, like then you will have like more opportunities in tier two. Pros is like if you love interventions, you have to take this branch. Obviously, like this branch is about interventions, and if you love heart, if you love to deal with heart, then also like it's like this is the best branch you can. It's like interest. If you are interested in cardio, and if you are a pediatrician, previously you had only one gateway, like you have to do adult cardio, but now you have a thing like you can master pediatric cardiology, where you will be focusing on congenital heart disease, electrophysiology, these things. So this is a better option.
Hi guys, sorry to disturb you in between the discussion. So I just wanted to let you know again that we are up and running with our pediatric super specialty program. So this is mainly targeted for those who are currently pursuing their MD, who want to double down on their basics in pediatrics to strengthen their concepts, their basic concepts from Nelson, and as well as who want to hold on to what they're learning in their clinics. Apart from obviously this is targeted in a major way for those who are preparing for the pediatrics group in the NEET SS exam, as well as the basic pediatrics part in the INISS that holds around 40%. So without further ado, I hope we have some amazing offers going on. So go on and enroll into our course.
So like practicing in tier 1 at the same time being a, you counted it among con, but at the same time there are only few branches that don't have that saturation in those cities. So in one way it's also a good opportunity for someone, if somebody wanting to settle in metros, and this is one branch which is actually easy to sort of settle. Then coming to your preparation, like I know your preparation, but can you just elaborate a bit for our listeners and how your journey of preparation has been, like post MD and through MD as well?
Okay, like for INISS, like everyone knows that the question pattern is like 30 is to 50. 50 questions will be from the specialty and 30 questions will be approximately from the general pediatrics part. So let me explain the cardio part first. So for pediatric cardiology, especially for the answering the 50 questions, you need to read Park's Pediatric Cardiology, which everyone knows. Most of the pediatrician knows about this book, Park's Pediatric Cardiology. The thing is, you should read this book from start to end. You should know in and out about the pediatric cardiology, like from the parts, so like all the congenital heart disease, arrhythmias, everything. You should first master Park's pediatric cardiology from page one to last page. Then there is another book called Mose Adams. This is like Bible of Pediatric Cardiology to like Bible of Pediatric Cardiology is Mose Adams. So this is a very big book. No one can finish this book for the entrance preparation, 2,500 pages approximately. But at least some topics which are not there in Parks, you can read in Mose Adams, which from which questions are. I can list some few topics. One important topic is fetal cardiology. Fetal cardiology part, definitely they will ask one or two questions in all like pediatric cardiology exams. So that part is not given in Parks. So you have to read that part in Mose Adams, like fetal arrhythmia, when will you terminate pregnancy, bradyarrhythmia in fetus, tachyarrhythmias in fetus, these things. And then pregnancy and heart disease. That part also is given in Mose Adams in a better way. And all congenital heart disease, because our crux is congenital heart disease, so it's better to have one more reading of all the congenital heart disease from Mose Adams, because in Mose Adams you will get a better understanding regarding the embryology and pathophysiology of the same congenital heart disease. For management part, you can read Parks, what surgery is to be done at what stage, when, these things. But for understanding the pathophysiology and anatomy, embryology part, you need to read Moose Adams specifically. And same with arrhythmias. Majority of the arrhythmias will be covered in Parks, but there are some extra accessory pathways, this Brugada syndrome, long QT syndrome, short QT syndrome. Like these, from these topics, definitely one or two questions will be coming. So those things you should be reading specifically in
Mose Adams.
and two or two, three drug trials also, like you should be reading, you should keep updated, like for regarding heart failure, what new drugs are coming, pulmonary hypertension, what new drugs are coming for pediatric point of view. Those things, the drug trials, those things you should be thorough. And definitely from Mose Adams, you should read about cardiac catheterization and then echocardiography, because one or two problem oriented questions from catheterization they are asking, like how to calculate QP, QS, those you will get a better understanding if you read Mose Adams. And then echocardiography regarding the probes, what frequency probes you will be using for visualizing what structures, those kind of questions you will get. Biostatistics, like that's like one or two questions they will ask. These two books are enough. Like like you will get time to read. Like mostly try to finish like Park's Pediatric Cardiology. Then whatever topics I have listed, try to read it from most items.
And like we already discussed a bit on the pros and cons, but for example, people still, don't get the correct idea of the branch unless somebody has been really closely, following it up. Like you have been in touch with so many pediatric cardiologists asking what happens in the branch, how their life is. So in general, what would you suggest for junior, that who should take up this branch? Like what kind of personalities with what priorities should take up this branch of peds cardio?
First, like you should not be a soft-hearted person to deal with hearts. That's what I feel like. Because when you do interventions, anything can happen. So you should be like slightly not very anxious person. Like I'm not telling like, but this branch requires like lots of courage also.
Should
Like
have a strong heart to deal with
strong
others.
heart to deal with heart. Yeah, that thing is there. And second, like I told you, we cannot immediately become a master of this branch just by doing a DM. Of course, it has a long learning curve. Like for each and every intervention, it needs like you have to like work under someone, master the skills, and then only you can become independent. And of course, like
That
you need to.
patience should be there, not only while learning but also in the long term.
Patients are there, like always it will be there, but the problem is like you cannot
No, I mean
do it
patience.
alone.
The person should have patience to
Yeah.
learn
And
the skill.
yeah, that thing is there definitely. Like immediately you cannot master, like become a master in this branch. And of course, like you need to have good rapport, like with other branch people, like CTBS, cardiac, and you should need a team.
Yeah.
Like in long run, like your own like CTV surgeons, cardiac anesthetist, intensivist, everyone. So you should form a team, and it's always about discussing about the patient and doing in pediatric cardiology. Nothing like you have to do it on your own. Everything, those things are there.
And a final word of guidance for your juniors who are tending to prepare for this PEDS cardio. Just an overview of how they can, go about it and whether or not they should choose this branch or what. Yeah, like we've talked about that, but at least for preparation aspect, any final word of guidance?
That's what like anyone can choose this branch. Of course, there are no limit. But if someone with the same mentality like me who joined pediatrics so that they can become a cardiologist
Yeah,
later by shifting into
yeah,
adult, they can think about pediatric cardiology because uh, I got fascinated for cardiology because not by seeing just MI, like all wholesome
yeah,
like
yeah,
congenital heart disease, everything. But when I got into pediatric, that time when I started seeing congenital heart disease more, I personally felt, yeah, this is what I want to do. I want to deal with congenital heart disease. I want to be a specialist in that. So I thought this would be a better option for me so that I'll be
yeah.
dealing exclusively with congenital heart disease. So I chose this one. In the same way, like if some pediatric residents are there who want to do cardiology, and if they have a
And
dilemma
it's
like
very common also, like people coming into pediatrics.
whether
Yeah,
to go for adult cardiology or
yeah.
pediatric cardiology, you can always think about this branch because you are a pediatrician. So you will have
The upper hand
extra
in
edge over
learning. Yeah.
this pediatric patients than the adult cardiologist. So obviously you can take this branch. So the thing is there, like if you are really interested in dealing with hearts, you can take.
Yeah. And like any one you would like to thank, your final vote of thanks for this amazing achievement, your parents, your anyone
My
you would want.
parents, of course, like they were supportive in all the way, and my friends and my own pediatric cardiologist from my parent institute PGI, like they were the reason, who motivated me in taking this branch since my starting days of MD pediatrics. Like I got motivated by seeing them, so I always wanted to thank them. And the other pediatric cardiology DM residents in my own institute who guided me for entrance preparation, what to read because even I was clueless. Like I don't know what to read for pediatric cardiology. I know there is a seat there. Like they only guided me like what to read, how to read, what type of questions they usually ask. So I want to thank them also.
Amazing, Swami. It was really nice talking to you. And
Thank you, sir.
more importantly, I hope the listeners get a lot of guidance from this talk. That is the main intention of this talk, because as we know, there's very little content available from especially these super specialty branches among pediatrics. So I hope juniors get a lot of important guidance from this. So
Thank you,
thank
sir.
you, Swami, for talking to us. It was really nice. Okay.
Sure, sir. Thank you so much,
Bye.
sir.